Hello, welcome to ANA community. In today's video, we are going to discuss the common errors that can occur while documenting the chief complaints or presenting complaints, which is considered to be one of the essential part of case taking. When you think about the clinical diagnosis, actually involves 5 steps: elaborate case taking, methodical physical examination, collection of all the data pertaining to the patient, selection of relevant data and rejection of irrelevant data, and suggesting laboratory investigations and certain imaging techniques to confirm the tentative diagnosis, that is considered to be the 5 different steps of the diagnosis. Throughout this particular case history, throughout the particular patient doctor interaction, while noting about the presenting complaints and case history, you are not supposed to ask any of the leading questions. The term leading questions refers to the questions where you are going to expect the right answers itself. You are going to expect the desired answer itself. That is what we can say leading question. For example, let us say, do you have pain? If yes, where it is? This is considered to be open-ended question. So when you consider the leading question as such, do you have a headache? Do you have cough? Do you have abdominal pain? Do you have pain in the upper abdomen? Do you have burning sensation? These are the questions that we can say, that is what we can say the leading questions as such. Preferably, if the person is able to give the appropriate history as such, then better avoid the leading questions. If the person is suffering from any kind of psychological disturbances as such, then leading questions can be asked. Otherwise, we can able to avoid it as such. While having an interaction, you need to interact with the patient continuously to say about the description of the presenting complaint, how that is being started, etc. etc. The patient will be giving you the information that has to be simply listened to as such. And whenever if you are looking into the presenting complaint, that may be having one or two associated complaints also, those has to be mentioned in bullet forms, and that too that should be mentioned in duration, and that should be mentioned in the chronological order. Chronological order refers to which has occurred first, then which has occurred next, which has occurred next, as such. Suppose if the person is having 3 presenting complaints, first presenting complaint you need to look into regarding onset, duration, severity, course of the symptom, aggravating and relieving factors. Then second presenting complaint, again you have to look into the onset, duration, severity, course of the symptom, aggravating and relieving factors. Third presenting complaint, onset, duration, severity, course of the symptom, aggravating and relieving factors. Then you have to note about the negative history as such. If the person is having the pain, in that particular situation, you are going to note about onset, duration, location, radiation, character, severity, course of the symptom, aggravating and relieving factors. If the person is having the pain, then you are going to look into these particular aspects. This is what the uh, the main things that we are going to follow while having a patient interaction in the bedside. Either it may be in the OPD or it may be in the IPD. In this particular video, we are going to discuss some of the commonest errors they are being done by the students while having an interaction with the patient. We are going to have the brief description. For example, the patients may say, I am suffering from diabetes mellitus since 2 years. So, in that particular sense, the presenting complaint will not be like diabetes mellitus since 2 years. That has to be presenting complaint. For example, the person may present with excessive micturition at night time, increased frequency of micturition. That has to be known. Or if the person is having the severe thirst, polydipsia, that means he will be consuming frequent water. That has to be noted there. If the person is the voracious eater, that has to be mentioned. I am having the uncontrolled appetite, that will be the presenting complaint. Diabetes mellitus will not be the presenting complaint. The person may say, I am having the wound which is not getting healed properly after taking the medications. Then we are going to think about the possible diabetes mellitus as such. For example, let us take some other example. The person may say, I am suffering from anemia. The presenting complaint is not anemia. The person may say, I am suffering. So you are supposed to ask, okay, what is the presenting complaint do you have? Do you have headache? Do you have palpitations? If the person is a lady, do you have menstrual irregularities? If so, how many days? That has to be documented in the presenting complaints. Then, if the person is suffering from hypertension, then you are supposed to ask whether do you have headache, do you have burning sensation in the eyes, do you have the nasal bleeding, etc. That has to be noted. Since how many days the person is suffering from, that has to be noted. Suppose if the person is saying, I am suffering from common cold. Common cold is a diagnosis as such, then that is not being written in the presenting complaint. Instead, what are you suffering from? Okay, what are you suffering from? Do you suffering from nasal discharge? Do you suffering from nasal blockage? Or do you have heaviness of the head? Or do you have the the perception of the smell is lost, etc. That has to be known. Or do you have pain in the ears? All they are indicative of the common cold. Do you have cough or sputum? If so, how many days? That has to be recorded there. Some of the vague complaints the person may present with. I am suffering from gas problem. Gas problem is actually a wide range of symptoms may be possible. Some persons may, I am having the excessive flatus passage. Some persons say, I am suffering from constipation. I am suffering from bloating sensation in the lower abdomen. I am suffering from bloating sensation in the upper abdomen. I am having excessive belching. I am having burning sensation, etc. I am having the sore belching, etc. These are the presenting complaints may be possible when the person is presented with gas problem as such. Some of the case sheets, they will write pain in stomach. Ideally, that is not the way to write. You are supposed to write pain abdomen. Simply pain abdomen since 2 days or 3 days, etc. That has to be written. When the further, that will be elaborated in the history of present illness regarding 9 quadrants of abdomen. We are supposed to ask the questions in that particular regard as such. Pain in the kidney. This is one of the misnomer. Most of the occasions, even today, the persons may say, actually, pain in the kidney, that is most commonly attributable to pain in the scrotal area. In the villages, the ignorance is in such a way that they will say that the females are not having kidney, only males are having the kidney. Actually, that is they are actually attributing to scrotal area. So pain in the kidney, you are supposed to ask what it is actually, whether is it pain in the scrotal region or pain in the back. That has to be recorded there. So regarding the next common error, that is inflammation in the lower limb. Actually, inflammation is a medical term. You are not supposed to write that particular inflammation as a presenting complaint. You are supposed to write whether do you have pain in the lower limb, or do you have swelling in the lower limb, or do you have the redness in the lower limb. That has to be noted there. Or do you have the what do you say that the difficulty in walking, etc. That has to be recorded. Anxiety or dizziness. The persons may present with, I'm having restlessness, unable to do any of the activities, I'm suffering from irritability, even the smallest sound, I'm getting highly irritated, I will bombard like anything, etc. So these are the presenting complaints the patient may present with. For simple trivial reasons, I will be showing too much reaction as such that will be given by the the patient. Indigestion since 5 days. Indigestion again, as we have discussed earlier regarding the gas problem. Even this may be the presenting complaints may vary. Some persons may say, I am having unformed stool passage. I am having bloating sensation in the lower abdomen or upper abdomen. I am having loose stools. I am having constipation, nausea or vomiting, or loss of appetite, or loss of taste as such. So this will be the presenting complaints. If the person says indigestion, you are supposed to poke what actually indigestion refers to as per the patient. Skin infection. Skin infection in the sense the presenting complaints may be the person may have itching, the person may have oozing, the person may have bleeding after itching as such, or the person may have discoloration of the skin, the person may be presented with disfiguration, etc. So these are the things that has to be specified. Regarding the pain in the legs, this is one particular the case document. They have written like this: pain in leg since n days, swelling in right leg since x days, lesion present in the lesion present since n days, burning sensation since x days, pus formation since n days, difficulty in walking. See, wherever if you see this particular presenting group of the presenting complaints, this can be pain in the leg, right or left, since X days, or skin lesion present in left medial part of the leg, or skin lesion present in the leg. That can be written. Burning sensation since so many days. Pus formation, or better word, pus discharge since X days, and difficulty in walking since X days. Here, difficulty in walking, probably this can be deleted also because all they are quite interrelated. Pricking type of pain in the lower limb. So actually, pricking type as such, this is nothing but the character of the pain as such. It is a point of a history of present illness. So that's why it should not be written in the presenting complaint. That has to be written in the history of present illness. In that particular situation, you are supposed to write pain in the left lower limb. That has to be along with the duration has to be mentioned. Blisters in the mouth. That means what are the presenting complaint? Whether the person is having the pain, or whether the person is having excessive salivation or dryness of mouth, or difficulty in speaking or swallowing, or the chewing is present or not, or whether the person is having soreness of the mouth, etc. That has to be written there. Mouth ulcer. Of course, the person may have pain during swallowing or soreness of the mouth, that has to be mentioned. So, pain radiating from the low back to calf region, pain radiating from shoulder to elbow, pain in the whole body starting from leg. Rather, it has to be mentioned pain in the low back region or pain in the neck. Then, radiating in the sense that's a part of history of present illness. That has to be mentioned in that particular part only. Chest pain on left side. Left side, it is the history of present illness part. Chest pain or chest discomfort since n days. That will be the presenting complaint. Persistent cough. Persistent, again, it's a part of history of present illness. Cough since n days. Sputum since n days. In that way, you are supposed to write in the corrections. Nasal congestion. Congestion is a medical term as such. So, the presenting complaints may be the person may have nasal discharge, the person may have nasal blockage, the person may have the post nasal drip from the nose, the person will be having the secretions to travel into the respiratory passages or the abdomen, that has to be the stomach, that has to be written there. Infection in the lower lip. So, it is not that. So, the presenting complaint should be pain in the lower lip or otherwise swelling in the lower limb or otherwise the person is unable to walk as such. Ideally, pain in the lower limb or swelling in the lower limb will be written in that particular regard. Acidity, in the sense you should be specific what actually acidity means. Whether the person is having a burning sensation in the epigastric region or burning sensation in the retrosternal region or the person is having sore erectations or bitter erectations, etc. That has to be written there. Severe stomach pain. So here severe is a part of, again, a history of present illness as such. Abdominal pain should be written instead of this. Swelling on internal side of lower lip towards left side since 10 days. Ideally, that has to be written swelling in the lip region since 10 days. Painful micturition, painful urination. Instead, write painful micturition or urination since 3 days. Watery stools or severe flatulence and bloating or severe back pain with weakness. Patient having chest pain for the last 3 days and shortness of breathing. Cough since 1 week, clear sputum since 5 days, and pain in chest since 4 days. Common cold, body pain, and fever since 2 days. Ideally, you can write watery stools or severe flatulence and bloating sensation. For example, severe back pain since 3 days, severe flatulence since 2 days, watery stools since 1 day. That has to be written in that way. Patient having chest pain for the last 3 days and shortness of breath. Chest pain since 3 days and breathlessness since 2 days. Cough since 1 week, clear sputum since 5 days, pain in chest since 4 days. Ideally, that can be written in that way. Cough since 7 days, sputum since 5 days, and chest pain since 4 days. Common cold, body pain, and fever. You can write running nose or nasal blockage or sneezing or heaviness of the head since 3 days, body ache since 3 days, and burning sensation all over the body since 2 days. That can be written in that way. Fracture in the left leg 2 days before. Ideally, pain in left leg, that has to be written. Blood infection. Instead of saying that, body ache, raised body temperature, or lethargy, or heaviness of the body parts since 2 days or 3 days, as such, that can be written. So here one more aspect, it is being written. Some of these students may write 10-year-old male patient come with complaint of pus formation in left lower limb starting from toe, then next to two fingers starting from 3 months ago. No aggravating factors. Ideally, pus discharge in left lower limb since 3 months and pain in the left lower limb since 3 months has to be written in that way. Bowel not clear. Instead, constipation since 4 days or unformed stool since 4 days or incomplete passage of stools since 4 days has to be written. Itching in both palms and soles from past 2 years. Cracks along with bleeding due to itching from 2 years. Burning sensation in sole and palm since 2 years. Instead, ideally you can write itching in upper and lower limbs since 2 years. Discharge through the skin since 3 years. And burning sensation since 2 years can be written there. The take-home messages from today's discussion are: no leading questions are asked. Leading questions are those where you are going to expect the desired answer. The presenting complaint refers to the complaint that seeks assistance from the doctors or surgeons. The presenting complaint should be written in patient's own words and in the chronological order. Major thing, diagnosis of the diseases done by other doctors should not be mentioned in the chief complaints column. Dear ANA community, diagnosis involves 5 steps. History, that to elaborate history, methodical physical examination, collection of all data pertaining to the patient's history. Fourth step is selection of the relevant data and rejection of irrelevant data. And fifth step is the suggesting the elaborate investigations or imaging techniques. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners or true Ayurveda learners or true Ayurveda diagnostic learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.